why don't you introduce yourself and tell us a little bit about maybe your background and how you came to be in Springfield Hospital?
Oh, we'll see. My name's Aaron Bennett. I'm a general surgeon, and I first came up to Springfield and helped support them in 2022. And I've been working there in one capacity or another since then. And I've recently joined the Springfield Hospital Specialty Group as a full-time general surgeon with my partner, Dr. Lewis, who's right here too.
Right. So yeah, I'm Dave Lewis. My cousin is actually Daniel Lewis. And
Really?
Yeah. So he would be freaking out right now because he's definitely has made it very clear to me he never wanted to be a doctor. But I'm Dave Lewis. I'm from New Hampshire. I grew up in New Hampshire. I went to school locally in New Hampshire, and then was in the military for a period of time, and ultimately came back to settle. And I have really, just like Aaron here, I've always really wanted to work in a community, and so I came here about 4 months ago to really be part of a community practice. So I mean, having been at really big hospitals in the past, this is really exciting for me.
Great.
Yeah, I agree.
And sort of tell us what is general surgery and how would you describe it?
Well, general surgery, I'd like to joke that if you ask me, is there a surgery that you do, I'll generally say, yes, I do that surgery. But general surgery is really a very broad discipline that is mainly, surgery involving the abdominal cavity and all its contents and organs. It also involves all the skin surfaces, including lumps and bumps and breast cancers. And it also, the general surgeon is traditionally the trauma surgeon. So we, take care of, gun and knife injuries, blunt traumas. Now, Springfield Hospital, that's a, we're not a trauma center, but, both Dave and I come from that background of taking care of the worst of the worst and the sickest of the sickest. But, with that type of operative expertise, in our general surgery program that's here, we're able to offer an incredible amount of expertise. David and I were talking about the other day, we have a partner who's not here, Dr. Kevin Berman, but combined, our, operative expertise is, over 45 years of operative excellence. So, it's, I won't say that we're hot shots, but I would.
Go ahead.
Toot our own horn, but this is, that we are tried and tested surgeons, and we have a lot to offer, the community.
So I think you jumped the gun on the next question I was going to ask. So I think that it's important to note that while you're new to Springfield Hospital, you're not new to the general surgery game. And that's important for people to understand, because they might look at the profile and be like, oh, they just got here a couple years ago. How much experience? But 45 years is a pretty good amount of combined experience.
Yep. No, there's the new car smell has
It's worn off.
Has worn off. Yes.
Awesome.
Yeah,
You had great with
we
analogies.
joke about the gray hairs, and they are sneaking up, and certainly both of us have been at least 13 to 14 years involved in all sorts of different aspects of patient care. So I think that it requires a lot of expertise to work in a community, because you are doing a broad base of care, and I think that you're taking on the role sort of as a quarterback, where you're trying to make sure that the whole team is organized, and making sure that patients get the care they need from us, but also get the care where they need to go. Sometimes they have a complex issue, and we can help streamline their care and be a backboard for them. And so I think having a lot of experience is really critical to being successful in a community.
Yeah. You mentioned before that a phrase that I really liked was, we're not so much surgeons as doctors who do surgery. And I really think that's a very good distinction, and it really is more of a patient-centered.
Yeah, general surgery, as Aaron was saying, is kind of a nebulous term. And the way I looked at it was, when I started, I wanted to be a doctor. I didn't really know what type of doctor I wanted to be. What I really wanted was just to use science and my brain to just help other people get through really difficult things. And a lot of things that happen to people quite often are not their fault, and it just comes out of nowhere. And just to kind of stand up and say, I can't prevent this, but I can certainly help you get through it, is something that I felt would really provide me with some meaning in my life. And the closest thing I saw to like an old school doctor who took care of a community, kind of the black bag going from door to door, was actually really a general surgeon, because we do as Aaron was saying, we do the gastroenterology and the endoscopy, and we do the hernias and we do the surgeries, but we also, having had this general training, our understanding of all the other issues that come with taking care of a patient. And so I think a true general surgeon in a community is someone who said, I'm one of your doctors first, and I'm here to help you. And if in fact surgery is one of the ways to help you, I'm going to do that in the safest way possible for you in an individualized care.
I think earlier I wrote down the note from the conversation we had, and I think, Dr. Bennett, you mentioned this. You take a whole patient approach.
That's right. And, that I'm an osteopathic physician, so that my medical title is DO, which stands for Doctor of Osteopathic Medicine. That the training is, I would like to refer to it as kind of the liberal arts of medicine, where, that we take a whole body approach to a patient. And, it's been wonderful working with Dr. Lewis, because, that he's a big believer in that too. Mm-hmm. And that, by looking at the whole patient, not just looking at a set of symptoms, I think that's what really distinguishes us. And instead of, calling us general surgeons, I think, probably the appropriate term would be community surgeons.
Yeah.
We are a community surgeon group.
And you actually gave an example where you kind of had to go outside the box, because someone came in with a symptom, mm-hmm. and then you realized that the symptom was caused by some. Can you tell that story? Some other things?
Sure. This is actually a patient that I saw this morning. Not to get into too many details, per privacy concerns. But the patient was seeing me for a specific concern, but had revealed to me that that there were a lot of social stressors in his life. Taking care of an elderly parent, and very much overwhelmed by being the sole caretaker. And after talking with him, I said, we have social workers and case managers that are over at Springfield Hospital, and I would, with your permission, I'd like them to reach out to you so that they can help you identify community resources. And afterwards he thanked me, saying that you are the first person, the first physician that has reached out a hand to me, and I feel like I'm drowning, and I'm so hopeful that I know a physician like you. And so
that's the key right there.
Mm-hmm.
That's the difference that I think sets a small town hospital like Springfield apart from other larger it's just the nature of the fact you're smaller, and that you know the rest of the staff, you know the departments, there's, I think you used the term, there's not many layers. Like, you don't have to go through a lot of layers of paperwork.
No, absolutely. That any patient can call our office and self-refer themselves for an appointment and talk with me directly. Sit down and talk instead of going through gatekeepers. And there's not a structured layer of administration and mid-level providers to block a patient from seeing a surgeon such as myself or Dr. Lewis.
And what's your turnaround time if someone does call?
I can see them the next day if need be.
That is
That's pretty
amazing.
And sometimes even the same day. We have our staff will bring our attention to when there's emergencies. And with our group we have 24/7 on-call coverage for the Springfield Hospital Emergency Department. So myself or the David here, there's always somebody that's there in the wee hours to take a look at a patient if need be.
Again, that's super important to have all that, like, less than 20 minutes away.
Yeah, that's really
That's
amazing.
huge.
Yeah, I think
Yeah.
it's I think it's also a cultural thing. I think that one thing I've really appreciated about Springfield Hospital has been that we've been encouraged to have visits that are 30 minutes or longer, and there's the idea is that the two of us, we come in, we sit down with the patient, and the referral might be for a groin hernia, but the patient is not a groin hernia. That's what they're referred for. But then comes the context.
Right.
And so you sit down and you talk to that person and you find out, hey, you may need this fixed, but here's the recovery time. And as you talk and have a back and forth with the human being, they may say something like, well, doc, this is the busiest time for my business, and is this the best time for this surgery? And it may not be. And so we have, I think because we have a culture of patient first and people first, we can have that honest conversation and say, well, you know what, what we really want is what's best for you. And so this surgery may be necessary and may help you, but it may need to be delayed to fit in with the other concerns you have in your life. I think it's hard to get to that if you have a culture of this person is a hernia and we're going to fix the hernia. And that's where I think the doctors who do surgery come in, that we're here to learn and understand the person and then decide, is a surgery going to actually help that human being and not just fix something because it's there.
Yeah, I think that we are a community's safety net. The patient coming in, we can tell them, is this something that has an acute need, or is this something that we can take a wait and see approach towards, or is this something that let's plan on doing this in the near future. And being able to give a patient reassurances is a big part of our practice. We certainly get referrals where people come in thinking that that they have to address this immediately, and just knowing that they have a fair amount of wiggle room, can give them a real relief. And so we're that in addition to being the physicians with physicians with knives, or internists with knives is what we used to joke about it, is that we're humans too, and we understand the pace of life in the community.
So what I'm hearing is that you can get in touch with, you can have very quick turnaround time if you have an issue, because you're going to be stressed if you think you have an issue. Then you're going to listen to the whole person and assess, is it really an immediate need, or can it wait, which takes a lot of stress off the person that's coming to see you. And you look at the whole picture.
Absolutely.
Like, maybe there's other services that would certainly help, because Yeah, and I think that we've gotten so far away from that. I mean, we're kind of almost going back to, I like the analogy, the doctor with the black bag. I immediately thought of Dr. Powers, who was the local doctor here in town that made house calls, and yeah, he did everything under the sun as in his practice. But maybe that's how we all need to go back, with the changing in healthcare and stuff. I think that's
Well, you
important.
mentioned also that there are better outcomes, and I'm sure it must be easier on the families if you're more local. If you don't have to go 2 hours to Boston or Albany or Keene or anywhere else.
Oh, absolutely. That there are studies that show this. But my experience with the facilities, like Springfield Hospital, that they're staffed by local community members. So, that we, as a whole, we have more skin in the game, and that we're taking care of family, friends, and loved ones, and a patient who's critically ill in that setting, the outcomes can be a lot better. That I've found. I've also worked in big, facilities in the inner city, where it's easy for patients to get lost in the cracks. Rotating staff, and that the staff is, that they don't have their heart in the game. Here, as a general surgeon, or a community surgeon, that our practice is built on word of mouth, and to be honest, a surgeon's only as good as his last case. So we
Much like an actor.
we have a lot of skin in the game to to make sure that things go well, and we're certainly up to the challenge here.
And we're down to about 4 minutes, but I think that gives us time to briefly talk about a new. This is usually your cue, Mike.
Yes.
You like things new, but a foregut surgery.
Yeah. So foregut surgery is. It's funny. I was talking to my brother, and I said to him, you have an ecchymosis right there, and he goes, well, what's an ecchymosis? And I said, oh, it's a bruise. And he goes, well, why can't you just say bruise? And so, I think we sometimes make things more complicated than we need to with foregut this and that, but. What we're really trying to do is use. Both of us are advanced laparoscopic surgeons. We do minimally invasive surgery. What we really do is what's right for each person. But we have a skill set that involves this, and there is a subset of patients who have what are known as hiatal hernias, or they have a portion of their stomach up in their chest, and this can cause very, very severe reflux. Many people can have their heartburn or reflux controlled with medicines, but some people can't. And what you don't want to have is just a long-term erosion and injury that just never gets better. And so among the many things we're bringing back to the community is what we call foregut surgery, or surgery done laparoscopically to help people with hiatal hernias or reflux or various other ailments that involve the upper gastrointestinal tract.
So for people who don't know what reflux is, how would, if someone came in and described a symptom, what would it be?
It would be, expressed as burning in the chest, sour taste in their mouth, or the colloquially known as backwash, on a frequent basis, and that can be quite upsetting. That's usually when.
So would it be something? Would people say I have heartburn? Or
yeah. They typically refer to it as heartburn. That's a common term.
Oh, sorry. Sometimes the symptoms are things you wouldn't think of. A cough, hoarseness, feeling like you can't swallow. Another fancy term, dysphagia, which is just kind of a catch-all for things aren't going right. But I think that. Not only would you might feel heartburn and you're reaching for Tums or something over and over again, and it's affecting your life, but there's also silent damage that can happen. And so along with doing the surgeries, we also do the medical treatment, and we do the endoscopy to look and sort of calibrate. But for a patient I think a lot of it would be, there's just, concerns around eating, that things hurt. Why does
Yeah.
this hurt? Why do I have pain here? Why do I have the traditional term heartburn, indigestion? I'm taking these medicines every day and I'm not feeling better.
And if they've had that, then they should be calling someone to talk to you, right?
Yeah, I think so. And not necessarily because everybody's going to get surgery, but they're going to get an assessment. They're going to potentially need to have someone look endoscopically, and then we're going to calibrate a treatment that's best to their needs. And sometimes that's education. I mean, I think both of us, one of our biggest goals really at the end of every visit is to make sure that the person who comes to our office feels educated on what is going on. I think, our healthcare system nowadays has got some issues, and I think patients are better served if they feel they have a strong foundation as to what's going on with them. And so sometimes just teaching is important.
Great. On that note,
We have about
running out of
37
time.
seconds, so I am going to super quickly, because I have it written down. If you want to reach this Springfield Hospital General Surgery, it's in the Ridgewood Professional Building, Level A. That's up at the hospital. It's the building adjacent to the hospital. 802-885-5600. Give them a call.
great. And that's it for this week. We'll see you next week on the feed. Bye.